Hi, I'm Dan Kuperstein, SVP of Compliance for Corporate Synergies, and welcome to our COVID-19 compliance briefing, where we're going to be discussing new rules and answering common questions that we get from our clients on compliance topics relevant to health and welfare benefit plans and insurance arrangements. And we're going to be focusing in on how they've been impacted by the ongoing COVID-19 pandemic. So we have two really big topics on our agenda today, which are one, how do we apply these new compliance deadline relief rules that essentially pause the compliance clock when counting days for deadlines? And we'll go through a couple of examples and we'll discuss that. And then we'll talk about the question of, is my organization required to amend our ERISA plan document and SBD to account for all these new COVID-19 compliance rules? And spoiler alert, or short answer is no. There's really no, none of these COVID-19 health and welfare plan related rules absolutely require a plan amendment. But it's certainly a good time to talk to your friendly benefits consultant or ERISA attorney to make sure that you're properly communicating with your employees and participants about how the plan is changing. Okay, so today we're talking about all the new U.S. Department of Labor, EBSA, and IRS Treasury rules that were issued between April 28th and May 1st of 2020, and specifically the new regulation entitled Extension of Certain Timeframes for Employee Benefit Plans, Participants, and Beneficiaries Affected by the COVID-19 Outbreak. That's the regulation that allows you to extend the deadlines. And then we're going to be talking about the DOL's EBSA Disaster Relief Notice 2020-01 and the relevant FAQ guidance issued by the DOL on this topic. And we'll generally refer to all of these together as the new rules, just to kind of keep everything simple. And we're going to go give some examples of that. We're also going to talk about new model Cobra notices that were issued by the DOL on May 1st, but did not expressly take into account any of these new COVID-19 deadline extension rules. So definitely some interesting developments happening. And so these new rules, in summary, are what ERISA lawyers like myself and other lawyers like to call tolling period rules. But that's just a fancy word for rules that push the pause button on the compliance clock that's used to help employers and participants measure the time frame or number of days remaining for employers, participants, and beneficiaries to take some kind of action relevant to their benefit plans. And as background, what's happening in these new rules is that the government agencies that I just mentioned, they're trying to ease compliance burdens in light of all the financial and personal difficulties that employers and participants are experiencing due to the pandemic. So they're extending certain compliance timeframes or deadlines that are otherwise applicable to group health plans, including disability and other welfare plans subject to ERISA and the Internal Revenue Code. And so these new deadline extension rules apply virtually to all group health plans that we commonly consider to be health and welfare plans, like medical plans, but also account-based group health plans like health FSAs. And these new rules also create, significantly, they create a period of time called the outbreak period, which is essentially that's the disregarded period or the pause period, right? When none of these deadlines can move. And this outbreak period is defined as the period of March 1st of 2020, which is the date of the start of the U.S. national emergency for COVID-19. And they continue until a date that is the 60th day after the end of this national emergency. And so I think what's really notable here, what's interesting about all of this is that it's, this time period is a period of indefinite duration. And so, we don't really know at this time, at least, we don't really have any idea of when this tolling period or this pause period it will end. And so it's kind of a big question mark, right? It's like, how long do we have to pause our compliance deadlines? And so let's first talk about a little more background as well. Which deadlines are affected, right? So the following types of deadlines are affected. For Cobra, you would be disregarding or putting on pause the following time frames: the 30 or 60-day deadline for employers or individuals to notify the plan of a qualifying event, the 60-day deadline for individuals to notify the plan of a determination of a disability, the 14-day deadline for plan administrators to furnish Cobra election notices, the 60-day deadline for participants to elect Cobra, and the 45-day deadline in which to make a first premium payment, as well as the 30-day deadline for subsequent premium payments. And here, when we're talking about Cobra, I think this is where there's been a lot of attention. That time period that, with regard to these payment deadlines for Cobra, the participant who elected Cobra coverage but who has not timely paid for such coverage is still going to be on the hook for paying those unpaid Cobra premium payments after the end of the outbreak period and prior to the end of their applicable compliance payment deadline. And as I'm going to discuss later, this has caused some confusion for plan sponsors, administrators, insurers, and PBMs, as technically, since the sponsors and insurance carriers cannot terminate or deny coverage during this time period where payment has not been made, this could lead to situations where qualified beneficiaries rack up millions of dollars in claims spend and then never pay those premiums or claims dollars back, which could be particularly costly in a situation of a self-insured prescription drug plan, for example, where the RX, the drugs have been dispensed to the participant, but the participant never makes the Cobra premiums after the permitted pause period of the outbreak period. And since there would be no way to retroactively terminate the RX claim, this could lead to the plan sponsor being on the hook for these claims, and it could just be a very costly situation. Okay, so what other deadlines are paused? Also, the HIPAA special enrollment deadlines, the 30 and 60-day HIPAA special enrollment periods are extended. For claims procedures, the deadlines are extended for individuals to file claims for benefits on group health plans, including for health FSAs, for initial disposition of claims, and for providing claimants a reasonable opportunity to appeal adverse benefit determinations under ERISA. So also for the external review process, non-grandfather group health plan deadlines have been extended for providing a state or federal external review process following exhaustion of the plan's internal appeals procedures. And then additionally, for plan sponsors, employers and plan sponsors, the deadlines have been extended for furnishing notices and disclosures. And then more specifically, plans and responsible plan fiduciaries will not be treated as having violated ERISA if they act in good faith and furnish any notices, disclosures, or documents that would otherwise have to be furnished during the outbreak period, including those requested in writing by a participant or beneficiary, as soon as administratively practicable under the circumstances. And so, assuming your entity, is affected by COVID-19 and has a good faith reason to delay those disclosures, you can get a reasonable amount of time to extend your ERISA disclosure notice obligations. So we're going to do some examples, and keep in mind that this outbreak period, right, which I think is still very confusing for a lot of folks out there, is the time period that's ignored when determining timeframes for these health and welfare plans. So just think of it as just the pause period, right? Disregard a time period. And we're going to look at examples from both Cobra and HIPAA special enrollment. And in our first example, we're going to look at a situation of electing Cobra coverage before the outbreak period. And keep in mind, normally a participant has 60 days after the qualifying event that caused them to lose coverage to elect Cobra. And what's really interesting here about how this works is that, right, the period that you have left on your compliance deadline before the outbreak period starts is essentially frozen, right? It freezes, it's paused, and then it's transported to the period that's after the outbreak period. Right, so it's basically you're taking the amount of days you have left on a compliance deadline, and you're putting everything on pause, stopping the compliance clock, and moving it to the end. And I think that's a little bit hard for people to kind of conceptualize this sort of pause period, but that's essentially what's happening here. So in our first example, Jane experienced a qualifying event due to a reduction of hours on December 18th of 2019. The plan is set up to carry benefits to the end of the month, so Jane's coverage will end on December 31st of 2019. Jane received her qualifying event notice on January 15th of 2020, and normally she would have to elect Cobra within 60 days from the receipt date of this notice, which would be March 15th of 2020. However, since the compliance clock was paused on March 1st of 2020, that is because that's the start of the outbreak period on March 1st. Then the last 15 days Jane would normally have had to elect Cobra would be paused as well. And so let's just assume now, for purposes of these two examples, that that the U.S. national emergency ends on May 31st of 2020. So let's just assume that it ends in about half a month from now. And so what that means is that the outbreak period, just for purposes of these two examples, would go from March 1st of 2020 and through July 30th of 2020, which is 60 days after the end of the national emergency. So that's how it's calculated. That's how you calculate the outbreak period. So basically, for purposes of these two examples, from March 1st of 2020 through July 30th of 2020, everything is on pause. We just disregard that time period when we're counting down the compliance deadlines. Okay, so going back to our example with Jane, right? She received her qualifying event notice January 15th. Normally, she'd have to elect within 60 days from the receipt date of that notice. However, since the compliance clock was paused on March 1st of 2020, and those last 15 days that Jane would normally have had to elect Cobra were paused, and then were then unpaused and added to the end of the outbreak period. That is, they start rolling again after the outbreak period ends on July 30th of 2020. And so now the new deadline for Jane to elect Cobra coverage is August 14th of 2020, which is 15 days after July 30th of 2020 and 75 days after the end of the national emergency. Of course, we don't really know yet when that happens, and that's why this is still a big indefinite time period. We don't know necessarily when the end of the COVID-19 national emergency is going to be. So let's take our second example. Let's look at a HIPAA special enrollment period example. Normally a participant will have 30 days from the date of the qualifying event, like a new dependent child, or giving birth or adoption, to enroll that new child into the plan. So let's say Jane gives birth on February 15th of 2020. She would like to enroll her new child in the healthcare plan. Normally, Jane would have to request a special enrollment on her employer's plan within 30 days of the birth, so by March 16th of 2020. However, since Jane gives birth 14 days prior to when the compliance clock is paused on March 1st of 2020, which is the start of the outbreak period, those last 16 days of her 30-day time period to request enrollment are then paused and added to the end of the outbreak period after the outbreak period is over, right? So now the new deadline for Jane to elect coverage for her child is August 14th of 2020, which is 16 days after July 30th of 2020, and 76 days. It happens to also be 76 days after the end of our hypothetical, national emergency end date. So that's kind of how this whole thing works. And I realize that's, a lot of information, but and hard sometimes for non-lawyers or non-lawyers to figure that out. But it's it's very important for figuring out when the deadlines are due under these new compliance deadline rules. So we should also mention here briefly that there is an ongoing debate right now that's out there. It's currently by law firms, consultants, commentators, Cobra vendors, Cobra administrators on these new rules, and about whether or not these rules create what is sometimes referred to as a suspension period, which essentially means that carriers can suspend the Cobra coverage. That is, they can effectively deny claims without technically terminating or canceling the qualified beneficiary's eligibility for Cobra. They can deny those claims for the periods of time for which the participant is not paying his or her Cobra premium on a timely basis. Now, this is an interpretation. There's nothing in the regulations that says that you can do this, but it's because there's some wording in the regulations that says they have to still remain eligible but not covered. That's one way that it's been interpreted. There's also an interpretation out there that claims should be pended. That again is also not in the language of the regulations, and so there's still a lot of confusion out there. And we would really welcome additional guidance from the DOL on precisely how these new Cobra rules are supposed to work. And we have reached out to our contacts at the DOL, and we do expect to hear from them hopefully this week. But in the interim, plans should, at a minimum, be communicating with their Cobra administrators and vendors to ensure that they understand precisely what those third-party entities will be doing and how they'll be responding to these new rules. And so still a lot of confusion out there about how this is all supposed to work. But it's always really good to make sure you communicate with all of your vendors and third-party Cobra administrators, and really really be in regular communication with them, especially now as since the rules have just changed. So let's also talk about plan impact and plan disclosure. Generally, and we're going to start this part of our briefing with the Cobra rules, because these are really generated the most discussion among our clients. And since, as we've already discussed, plan amendment and plan disclosure are not expressly required under these new rules, the big question, and the one that we're really getting from our clients, is really about, well, should we do a new plan disclosure when it comes to these new deadline extension rules? And the question of to disclose or not to disclose, right? That is the question, right, at the end of the day here. So since there's no required or model disclosure about these new deadline extensions, plans and employers sponsoring plans have some different choices here. They can disclose more, they can disclose less, or not disclose anything at all, or simply wait and disclose later. They can also disclose the model Cobra notices that came out on May 1st and send them out as is, although these don't even address the deadline extensions from these new rules, and they were only modified to provide additional information about Medicare enrollment. And so while the timing of the release of these new Cobra model notices seemed a bit strange or unusual, and might have suggested that the DOL is okay with plan sponsors effectively doing nothing about these new rules, we would generally recommend that employers exercise more caution here in light of their general ERISA fiduciary duties to disclose and communicate necessary information to plan participants and beneficiaries, as well as the fact that there's been quite a lot of litigation recently on the topic of what was an appropriate Cobra notice and disclosure, what was included in that Cobra notice and disclosure. So there's a lot of litigation. There's plan fiduciary responsibility. So it's probably best to do at least something, or at least to consider something. So in our view, plans should at least consider some type of notification to Cobra participants of the consequence of not paying the full Cobra premium at the end of the outbreak period. That is, a disclosure of something along the lines of, or to the effect of, the plan will not cover claims from any month for which the premiums are not paid prior to the end of the applicable payment deadline after the end of the outbreak period, or alternatively, something even more, general, language perhaps to the effect of, please note some compliance deadlines and or payment deadlines have been extended as a result of the current coronavirus/COVID-19 pandemic. Please contact HR if you have any specific questions about these deadline extensions. That kind of general language probably is going to be okay. And I think some of the concern there is, do we want to be notified? I think some of the concern that we hear from employers is, and plan sponsors is, do we want to be communicating to everybody that they don't have to pay their Cobra premiums? Especially now in a time when a lot more people than normal are going to be on Cobra because of the pandemic and its impact on the economy. So a lot of considerations to consider, but in the end of the day, it's probably best to at least do something and consider at least some disclosure, even if it's very general. And while, of course, we don't have time today to talk about all of the different compliance implications of these new deadline relief rules, we also wanted to take some time today to talk about the impact of all of the other new COVID-19 related laws and regulations on your plan and plan documents, and particularly, as we said earlier, right, even under all of these other new COVID-19 rules, like the FFCRA and CARES Act, right, all of these new rules for HDHPs, for telehealth, and for other plans and plan services, there's really no express requirement in any of these rules to amend your ERISA plan documents and SPDs. There's really nothing that you absolutely have to do with your plan documents as a result of all of these new rules. But it's definitely a good time to do it, right? There's nothing saying that you can't do it, that you can't review it with your benefits consultants and see, well, where are there gaps, where are things that need to be communicated, especially, now in light of all the things that have happened.
you want to be making sure that your your plan documents accurately reflect all of these new rules and are communicating things effectively. Now, most competently drafted plan documents, will have provisions that account for changes like this. Sort of catch-all provisions like in there, like a catch-all eligibility provision that says something to the effect of, to the extent that new federal, state, or local leave laws or regulations require any changes to the plan's eligibility or payment rules, the plan will adhere and comply with such new rules and regulations. Or, most competently drafted ERISA plan documents and SPDs will also refer to annexed certificates of coverage from the insurance carriers when it comes to new rules that may have a very specific impact on plan cost or incremental or other benefit changes. And so in most cases, if there's going to be a change to your plan document, it's going to be probably in one of those insurance carrier certificates of coverage that's annexed to your plan document, and that the carriers will be producing. And so in most cases, there isn't really anything to do there, except it's important to review that and make sure that it's accurate. And so even though there's no requirement to amend, it's always a good idea to check that. And this is particularly particularly relevant during this time period, to check those certificates of coverage to accurately reflect any agreements that you may have, particularly because your organization may have reached an agreement with your insurance carrier about a furlough period or a temporary layoff period. And I think in light of all of those things that we've seen over the last few months, whether it be reductions in hours, reductions in force, furloughs, temporary and permanent layoffs, including furloughs that included combinations of all of the above, and furloughs that are defined differently by 5 different jurisdictions and 2 different insurance carriers. And now is just a really, really, really good time to take a second look at those new certifications of coverage that make sure the carrier is sending that make sure everything that your carrier is sending to you accurately reflects those agreements that you have about those types of things that we just talked about. So, for example, if your agreement says that Division A employees who are working a reduced hour schedule during the furlough period are eligible, for coverage if they work for at least 20 hours on average per week, you'd want to make sure that the cert doesn't still say 30 hours or something else. So that's it for today. I really want to thank you for joining us. And, since we went well over the time for today's briefing, I'm just going to pause here for a couple minutes. If you want to send in your questions, and then rather than me addressing all of them live today, we're going to respond to your questions in a Q&A document that will be publishing to our Hawk Health and Welfare Compliance social media page later this week. And we really want to thank you for joining us today. Thanks.